Yeah. Okay, fine. Shall we start? Yes. So how was the question? How was the question? Was it easy? No? Why? Why it is not easy? Majority of the questions were very easy, isn't it? Majority of the questions were very easy. Some questions were a little bit confusing, isn't it? Other than that, all the questions were easy, right? Okay, fine. Shall we start? Yes. So the first question. Yeah, first question. Squamous cell, cuboidal cell, columnar cell are classifications of cells. Classifications of cells. These are different types of cells on the basis of which category or which characteristics. On the basis of which characteristics this classification is made of. Okay, got it? So we know that cells, isn't it? Cells. What are the type of cells? Type of cells? Eukaryotic cell, prokaryotic cell, cuboidal cell, columnar cell, isn't it? So yes. Then muscular cells. Then yeah, come on. So there are different unicellular, isn't it? Unicellular organisms. So there are different classification for cell. So in that, on the basis of which characteristics this squamous or cuboidal or columnar are classified. What is it? Is it based of cell shape? Is it cell shape? Then what is the shape of squamous? Squamous. What is the shape of squamous? What is the shape of cuboidal? And what is the shape of columnar? Any idea? You said yes sir, it's shape. Then what are the shape? What are the shape? Okay, fine. Is it about cell layer? Cell wall thickness, cell wall layer, with cell wall, without cell wall. Is it? No, that is not columnar. Okay, fine. How about cell functions? According to the cell function, what are the classification according to this? Okay, fine. How about now? Can you hear it now? I think all of you have got a link, right? You haven't got any notifications? Exam paper upload cheyaleda? I think you have got a link, right? Okay, how about now? Voice. Okay, fine. So this columnar, cuboidal or squamous, all these are type of cell which is classified on the basis of cell shape. So do you know the shapes of squamous or cuboidal or columnar? Yeah, what are the shapes? Do you know the shapes? So actually yesterday I have given on a homework, right? Did I give you homework? My question is, did I give you homework? Tube light తెలుసా స్విచ్ ఆన్ చేసిన 10 minutes తర్వాత లైట్ వస్తుంది. ఆ క్వశ్చన్ ఎప్పుడో అడిగింది, ఇప్పుడు వస్తుంది ఆన్సర్. ఫైన్. ఎస్, ఎనీ హోంవర్క్ yesterday last class? Yes, what was that? I told you to do one thing, read one thing. What is that? Okay, what is that? Homework ఏం లేదా? అసలు చూడలేదు, అది చెప్పు. Fine, very good active members, isn't it? Is it what your dedication? Homework లేదా? ఉందా? చేసినావా? హోంవర్క్ చేసినావా లేదా? Very good. Very good, very good, very good, very good, very good. Job kavala udda? Kavala? But it doesn't seem like you want a job. Because you are not active, because you are not dedicated. If one is dedicated, they should follow the instructions. Instruction follows avutunda? Avutunda leda? Avutunda? Reading chesnava? Reading chesnava? Question practice chesnava? Fine, very good. Okay, fine. Exam ela rayali. Okay, nothing but Shashirega. First of all, just follow the instructions. Whatever we are giving you the instruction, just follow it. You can easily write the exam. Nothing else. That is a symbol. That is a symbol. Okay, that is a symbol one. That is a symbol one advice, because exam ela rayali, it's a big question, and day by day we are giving you instructions. From the first day onwards, we are giving you instructions. How to do, how to perform, how to attend the questions, how to read, how to reread, how to memorize, how to question practice. Everything we are training you day by day. So the entire training will be the result of your writing exam and your posting of selection. It is not a single thing. Shashirega. Okay, just follow the instruction, that's it. Okay, fine. So here the first question, coming back to first question. Anyhow, you didn't do the homework, right? Okay, leave it. So I won't repeat it. I won't repeat the homeworks. If you did it, just ask me, sir, we did the homework and that was the question, we did it. If you are not active, I am also not interested in making you active. If you are active, just come and say, yes sir, yesterday we have a homework and we did it. Have you done? చేసినావా లేదా? చేసినావా? హోంవర్క్ ఏంటి? అది తెలియలేదు. చేసిన హోంవర్క్ మనం చేసిన హోంవర్క్ ఏంటి? అది తెలియలేదు. వెరీ గుడ్. Okay, fine. So listen here. Anatomy. What was homework? What was the homework? What was the homework? What was the homework? Yeah, very good. Sailaja. Very good, Sailaja. Very good. One of the homework was classification of psychiatric disorders. అవును సార్, ఇప్పుడు గుర్తుంది. Just now I remembering it. అక్కడ కూడా ఒకటి హోంవర్క్ ఉంది, మర్చిపోయింది కదా, ఇప్పుడే గుర్తుకుంది కదా. Yes, just now you are getting the memory. Yes sir, yesterday there was homework. So listen here. Before leaving that door, after the classes, before leaving that door, just try to recall yourself. Today what are the things or what are the topics are discussed in the class? What are the topics are discussed in the class? So is there any homework? What should I do after this class? What are the things I have to read more? So you have to do that small homework. That is what it should be applicable in your life. Before sleeping, before going to sleep, you should recall the day. Yes, today what are the things done? How was my day? When I woke up, what are the things I did? What are the things I studied? With whom I have interacted? Whichever persons I have contacted with? Whom I missed? Everything you have to recollect it. Otherwise you can't go further in a planned way. Got it? It is your life lesson. Don't forget that. Okay? Okay, fine. Shape of? Louder. Shape of the epiglottis. What kind of leaf? Isn't it? What leaf? What leaf? What leaf? What leaf? That was also one of the homework. Isn't it? Sir, adu kuda undi. Spelling. No. Wrong. So fine, here. Come to the question. Anyhow, you haven't done the homework. So again, I am repeating you, do the homework. Fine. So squamous, cuboidal and columnar epithelium are classified on the basis of shape. So on the basis of layers, on the basis of layers, on the basis of cell layers. What are the cell layers? How many layers are there? Cell layers? 4 or 5? 4. Which are they? Huh? Which are they? Louder. Which are the layers of the cells? Deepthi, very good. Very good. Yeah. 3 layers. Which are they? Mesoderm, endoderm, ectoderm. Then ectoderm is having how many layers? I'll tell you, sir. Deepthi, the total day engaged with this 80 question, but is it worthy? With 80 questions, 80 into 4. 80 into 4. Enta? 80 into 4 on 10, yeah. 320, very good. 320 concepts we are clearing it, isn't it? Daily 320 concepts. Along with that additional points. Is it worthy or not? Deepthi? Okay, I will tell you faster. Can you follow it? You can follow it, but how about others? We have to consider holistically. Okay, fine. So come here. So squamous, cuboidal, columnar according to the basis of cell shape. So coming to cell layer, there are 3 cell layers. Which are them? Mesoderm, ectoderm, endoderm. Is it ectoderm again? Ectoderm. Mesoderm. Mesoderm means middle or outer or inner? Meso and middle ra. Middle. Ecto, outer. Endo, inner. So again this ectoderm, outer layer is classified into different 5 layers. Which are they? Stratum, stratum germinatum, stratum basale, stratum spinosum. Then inka 2 kuda unnai. What are they? Very good. Read chesnava leda? Reading chesnava? Okay. Question attend cheyadaniki prepare chesnava? Have you ever prepared for this question? Okay. Exam kuda itlane rashada? Don't write any exam without preparation. That is a humble request. It is a humble request. If you want a government job, basic few things you should follow. That is the basic one. You should read first. What do you have to do? Read first. So here what is it? We are spoon feeding you, isn't it? Whatever is it, we are scooping it a spoon and giving you. You are swallowing it. But even you are not even regurgitating it, isn't it? Spoon feeding is not at all helping for a proper government job or central government job. Whatever we are feeding you, you should think by your own. That is what called critical thinking. So for that, you should need reading. What you should need? Reading. That is the basic thing. If you want a government job or central government job, you should read. Before doing anything, just practice. What do you have to do? Practice before doing. So injections, IM injections. Directly you will go and do injections after your college time, or will you observe? Yeah, you will observe, you will train under a senior. Then only you can do an injection, right? So how you have to write exams? You should know what is the question, what is the exact answer, what may be the options, how could I reach the answer. What is the only one solution for that? You should know the knowledge. You should have the knowledge. For gaining the knowledge, what you have to do? Reading. When is the last time you touched the textbook? Textbook? Unda leda nursing textbooks? Emana unnaya? Unda? Okay, eppudu last adu open chesina time eppudu? When did you open the nursing textbook? Last time? Nenne? Monne? Ee roje chesnava? Very good. Okay, fine. So coming back. Okay, fine. Coming to cell functions. According to cell functions, what are the classifications? According to cell functions, ciliated cells, glandular cells. Is it what is ciliated function? Ciliated cell function. What is it? Mobility. Very good. Glandular cells. What is the function? Glandular cells. Glandular cells. What is the function? Secretions. Is it a secretory function? Glandular cell, secretory function, and cell according to the basis of function. It is classified into ciliated cells or glandular cells. Glandular cells. What is the function of ciliated? Movement. What is that? Cilia helping for movement. Isn't it? Where are they? Mainly in the GI tract, respiratory tract. Isn't it? What is that? Mucus movement. Isn't it? Mobility. It is helping for mobility. Glandular is helping for glands, which is for secretory functions. Isn't it? Secretory functions. And according to cell wall thickness, rigidity. Isn't it? Plant cells, animal cells. Is it same? No. Plant cell wall is more rigid or thick, and animal cell wall is thin. Isn't it? Thin. Okay, that is the thing. Okay, cell wall. So these are the different classifications of cell. So according to that, which kind of classification is squamous, columnar, and cuboidal? It is on the basis of cell shape. Cell shape. Have we got it? So we'll move on to the next. Okay, fine. The part of the cell that monitors the steps of cell division. Steps of cell division. What is the meaning of cell division? Cell division, mitosis, meiosis, isn't it? Mitosis, meiosis, cell division. One mother cell becomes two offspring cells, isn't it? Offsprings or daughter cells. Offsprings or daughter cells. That is called cell division. Out of that, which is controlling this cell division? Which this one particle is controlling the cell division? Or simply in central nervous system, we discussed one point. What? Neurons, isn't it? Neurons have three properties. Which are they? Conductivity, contractility, and permanency. Isn't it? Permanency means once it is damaged, there is no repair or there is no reproduction, because in neurons one thing is not there. What is that? Centrioles, isn't it? Em ledu centrioles or centrosomes ledu, dan kosam reproduction ledu or cell division ledu. So what is exactly helping for cell division? What is that? What is the answer? Centrosomes or centrioles helping for cell division or cell production. New cell production or cell division is controlled by centrosomes. Isn't it? Centrosomes. Okay, so how about ribosomes? What is the function of ribosome? Yeah, ribosomes, isn't it? Ribosomes are having the functions to produce protein synthesis. So mainly what are the things are there in ribosome? Yeah. What are the things are there in ribosomes? Protein synthesis. Endoplasmic reticulum. Ekkada unnaru? Yes, very good. Okay, endoplasmic reticulum. Endoplasmic reticulum, two types. Which are they? Smooth endoplasmic reticulum, rough endoplasmic reticulum. So what is the function? Production of protein. Production of protein. And production of protein. That is what protein synthesis. Synthesis means production. Got it? Injury. Louder. That point. Exactly that point. You mean this one? Engine or engine? Okay, anything. Anything we can pronounce. Okay. Engine of the cells, isn't it? So in the question, option C. Option C. What is option C? Very good. Power of the house cell. Why it is called as power of the cell? Power of the cell. Why it is said as power of the cell? Powerhouse. Power nahi, powerhouse. Powerhouse. It is not power. It is powerhouse. Powerhouse of the cell. Powerhouse of the cell. Why? Yeah, very good. It is having, because it is having energy currency. What is it? Energy currency. Energy currency is there. What is energy currency? What is known as energy currency? What is known as energy currency? What is energy currency? Very good. ATP. ATP is known as energy currency. Isn't it? Engine. What is engine? Engine. Okay. Engine of the cell is called as ribosome. Ribosomes are called engine of the cell because they are producing, they are or they are synthesizing protein with the help of endoplasmic reticulum. Got it? Yeah, fine. Here, mitochondria. Mitochondria is known as powerhouse of the cell because it is containing energy currency of the cell. What is that? ATP. ATP is the energy currency. ATP is producing energy, glucose energy. Isn't it? Yesterday we discussed. Isn't it? ATP splits into ADP plus phosphate. 3 splits into 2 plus 1. Isn't it? ATP. T and N, tri and N, 3. Adenosine tri 3 phosphate splits into 2 plus 1. Adenosine diphosphate, ADP plus phosphate, triphosphate, 3 phosphate split into 2 plus 1. Isn't it? At that time, energy releases. What kind of energy? Very good. Kinetic energy. That was one of the important questions. Okay, fine. Then coming to lysosomes. What are these lysosomes? Lysosomes are called? Lysosomes are called digestive system of cell. What is that? Digestive system of cell. Lysosomes are called digestive system of the cell. Why it is called as digestive system of the cell? Yeah. Digestive system of the cell, because these lysosomes are removing the dead tissues, dead cells are removed by lysosomes. Got it? That is what it is called as digestive system of the cell. So according to the question, what is the answer? Yeah, for cell division, which is helping? Centrosomes. Got it? So what is the right answer? Centrosomes. Okay, fine. Next. Okay, fine. Another question. Smooth muscles are likely to be found in. Okay. We know that in our body there are two things: smooth muscle and skeletal muscle. Smooth muscle, skeletal muscle. Skeletal muscles are made up of, or skeletal muscle are helping for the formation of voluntary muscles. Voluntary means we can control it. Voluntary means we can control it. Involuntary means we can't control. Involuntary organs or involuntary area or involuntary muscles are made up of smooth muscle. Involuntary. But skeletal muscles are made up of, skeletal muscle are voluntary. Skeletal muscles are voluntary. Skeletal muscles are voluntary. Okay, fine. So listen here. Other than that, one more specialized muscle, isn't it? What is that? Cardiac muscles. Isn't it? What is that? Cardiac muscle. So what is the question? Smooth muscles are likely to be found in. Smooth muscle ekkada unnaru. Got it? So options: muscles of the arm. Can we control it? Can we control it? If we can control it, that is voluntary. That is voluntary. If it is voluntary, which muscle is that? Skeletal. So that is not the answer. And muscles of legs. Control చేయడానికి వస్తుందా లేదా వస్తుందా? Okay, so we can control it, isn't it? Muscles of legs. So is it skeletal or smooth? Skeletal, obviously. That is also skeletal. So it is also not the answer. Then heart. Heart, we know that it has specific muscle that is called cardiac muscles, isn't it? That is cardiac muscle. So that is also not the answer. That is also not the answer. So what is the answer? What is the answer? Stomach, intestine. So we can see involuntary or smooth muscles mainly in stomach or intestines, isn't it? Intestine, stomach. That is the exact area where we can see smooth muscle. So what is the answer? What is the answer? Yes, very good. Okay, fine. Next one. Next. Homeostasis is the term used to describe. Homeostasis is the term used to describe. Homeostasis అంటే ఏంటి? Homeostasis. Homeostasis. What is the single meaning? Single word meaning? Equilibrium. Okay, equilibrium. Exact meaning? Balancing. Balancing, equilibrium. Okay. One more. Fluid. Not only fluid. Not only osmotic pressure. Even vitals. Even glucose level. Everything comes under homeostasis. What is it? One particular word. Can you describe in particular word? See, homeostasis, we can say auto-regulation. What is that? Auto-regulation. What is mean by auto-regulation? Auto means by self. By self. Auto-regulation. మన బాడీలు ఏమైనా చేంజ్ అవుతుంది, what happens? Later బాడీని ఏం చేస్తున్నారు? అది బ్యాలెన్స్ చేస్తున్నారు. That is what called auto-regulation or homeostasis. Have you got it? For example, temperature ఎక్కువ అయింది, అప్పుడు మన బాడీ ఏం చేస్తున్నారు? స్వెట్టింగ్. వాట్ ఈస్ ఇట్? స్వెట్టింగ్. అప్పుడు టెంపరేచర్ తక్కువ, నార్మల్ అవుతుంది. వాట్ ఈస్ దట్ కాల్డ్? హోమియోస్టాసిస్. ఓకే, ఇప్పుడు బీపీ తక్కువ అయింది, యూరిన్ అవుట్పుట్ బాగానే ఉంది, బీపీ దానికోసం తక్కువ అయింది. అప్పుడు మన బాడీ ఏం చేస్తున్నారు? ఏడిహెచ్ రిలీజ్ చేస్తున్నారు, లేకపోతే రెనిన్ యాంజియోటెన్సిన్ ఆల్డోస్టెరోన్ మెకానిజం యూరిన్ అవుట్పుట్ కంట్రోల్ చేస్తున్నారు, మళ్ళీ బీపీ కూడా ఇంక్రీజ్ చేస్తున్నారు. వాట్ ఈస్ దాట్? హోమియోస్టాసిస్. దట్ మీన్స్ auto regulation. So listen here. So from these options, what is the answer? The internal temperature of human body. Internal temperature of the two options together. Varying conditions of the body. Okay. Varying conditions of the body. Okay, fine. The internal temperature of the human body. Is it an example of homeostasis? Varying conditions of the body. Is it an example? How the body maintains its normal composition and functions. Body's normal reaction to an injury that causes bleeding. What is it actually? B. What is B? Yeah. Homeostasis means homeostasis is the term used to describe. Yeah, what is it? B. So, okay, fine, very good. So, here the option, the internal temperature of the human body. Internal temperature of the human body. What is it? Internal temperature of the human body? Core body temperature or visceral body temperature. Visceral temperature or core body temperature. That is maintained by different mechanism. Different mechanism. That is one of the example of homeostasis. One of the example of homeostasis. The internal body temperature. It is maintaining. But the term homeostasis is used to describe. The term homeostasis. That is used to describe by how the body maintain its normal composition and functions. Composition and functions. For example, tissue, internal organelles, external organelles, or intrinsic side or extrinsic side. That means simply we can say hormonal imbalance. Hormonal imbalance, injury, internal bleeding. Everything is auto-controlling by clotting factors, isn't it? Vitamin C and protein productions, isn't it? And healing, then vital balancing or vital sense, temperature, pulse, respiration, BP, everything auto-regulation by self, auto-regulation. That is the exact meaning of homeostasis. Homeostasis. Got it? Okay, so what is the answer? Okay. So most commonly in this exam paper, many of the textbooks they mentioned as temperature, internal temperature is an example of homeostasis. In that manner, there may be an answer key of option A, but actual answer is answer B. Actual answer is answer B. Actual exact meaning of homeostasis is B. How it is maintaining the normal composition, and other than that, suppose externally there is very unfavorable situation outside, environmental influence is there. For example, now the climate change, slightly our body temperature rise, isn't it? So in extreme cold area, when we go, what happens? Our body tries to increase our temperature. What is that? That is also called auto-regulation or maintaining the internal functions or normal compositions. So here one word specifically mentioned, normal functions, but composition, that is not at all related to homeostasis. Composition is not related to this one. But if it is function and regulation, that is the exact answer of homeostasis. Have you got it? Okay, fine. So here in the answer key, they may publish what? Internal body temperature. But the exact answer is yeah, to maintain the internal atmosphere. That means body atmosphere. So whatever may be the external environment, internal environment has to be regulated, maintained. Got it? Have you got it? So what is the meaning of homeostasis? What is the meaning of auto-regulation? What is that? Auto-regulation. Got it? Okay, fine. Don't go for this. Okay? Fine. Next one. So what is it? The hardest substance of the body. What is the hardest substance of the body? Yeah, we know that, isn't it? In the world, after diamond, the hardest substance is enamel. After diamond, what is the hardest substance? Enamel. Which is the most hardest substance in the world? That is diamond. Yeah, that is considered as diamond, isn't it? But after diamond, which is the most hardest substance in our body or in the world? That is enamel. After enamel, bone. After enamel, it is bone. And cartilage and tendons are not hardest, isn't it? It is not hardest. It is smooth. Isn't it? It is smooth fibers. Got it? Okay, Vanida. Same question came in the exam. What answer we put, sir? Okay, fine. If there is any auto regulation, or the option is regulation of internal temperature. Regulation. There must be regulation of internal body temperature. In that case, you can answer regulation of internal body temperature. That is an example of homeostasis. Or otherwise, generally they will give. What is that? The maintain and regulation, auto regulation and maintenance of physiological and composition and functions. That is simply called homeostasis. That is simply auto regulation without any external influence. Got it? Got it? Okay, fine. Next one. Yeah, Sudhakar, what happened? Yeah, I know. That is what I said. Don't think about that one. The answer I mentioned it. Yeah. Fine. Next one. So what is the answer? Which is the hardest substance? Enamel. Okay, fine. Next one. So in the human body, single structure made up of smaller structures of four major kinds. Isn't it? Which are they? Basic units are cells. Cells. More cell combines and forms tissues. More tissue forms and combines and forms organs. Many organs combines and forms. Very good. System. So what is the answer? Many cells become tissue. Many tissue becomes an organ, and combined organ becomes a system, respiratory system, isn't it? So alveolar cells. What cells? Alveolar cells. Type 1 cells, type 2 cells, type 3 cells, isn't it? These cells become form into tissue, isn't it? Alveolar tissue, acinar tissue. Okay, then it becomes an organ. What is it? Lungs. What is it? Lungs, bronchiole, multiple, nose, airway. That becomes a system, respiratory system. Got it? So what is the answer? The human body is a single structure made up of smaller structures of four small major kinds. Which are they? Cell becomes tissue becomes organ, and organ becomes system. Got it? Okay, fine. Next one. Oh. What happened? Okay, fine. Which of the following is not a use of microorganism? Which of the following is not a use of microorganism? What is it? Which of the following is not a use of microorganisms? Preparation of food by photosynthesis. What is it? It is not about all microorganisms. Some microorganisms are preparing food by photosynthesis. Some microorganisms, for example, algae. What is that? Algae. But it is not common. Or major. Algae are producing by photosynthesis, but majority are something like a parasites. They won't prepare by own, but they are dependent to some other tissues. Okay, fine. And preparation of medicine. Use chestunnara leda? Microbes. Yes, we are using it for antibiotics. Isn't it? We are using it for mainly it is using for antibiotics. We are using it for antibiotic preparations, for medicine preparations. And next one, recycling of materials in nature. Isn't it? Recycling, isn't it? Whenever one material is disposed, that will be recycled, isn't it? Yeah, very good, Dione. Okay, fine. So recycling, that is also one of the function of microbes, isn't it? Recycling, composting, recycling, that is also one of the function of microorganism. And increase the fertility of soil, isn't it? Fertilization, fertility of soil, isn't it? We are adding some of the microorganisms, especially at some time we will use as it, isn't it? For what purpose? For a better agricultural, we need a fertilized soil, isn't it? In that we will add some microorganisms, isn't it? It is also helping for soil fertilization. So what is not the exact function? What is not the exact function related to microorganisms? Yeah, what is it? Yeah, it is not a common use. It is not a common use of microorganism. Mainly we are depending upon plants for photosynthesis. This one, some of the microorganisms like algae are having this photosynthesis food preparation. Other than that, majority doesn't have this method. I got it. So what is the answer? What is the answer? Yes. Okay, fine. Next one. This is a direct question, simple direct question, isn't it? Yes. HIV virus is a type of, is it HIV virus is retrovirus. HIV virus is a retrovirus. It is not a DNA virus, it is an RNA virus, isn't it? It is a RNA virus and it is mostly we know that it is a retrovirus. Which virus? Retrovirus. That was a direct question. Okay, fine. Next one. Retrovirus. Okay, fine. Then artificial acquired immunity develops by which are options? Vaccination, after an attack of infection, repeated exposure to infection, naturally. What do you mean by naturally? Yeah, naturally means either it is getting from mother or it is getting through an infection, is it? Or it is getting through an infection. Natural, artificial, is it? Natural, artificial. Artificial ante through an infection, natural ante through mother. So here natural means through mother and artificial means artificial after an attack of infection. So repeated exposure to infection, what is that? Repeated exposure to infection, repeated exposure, what is that? Yeah, that is also acquired, but what is that? That is also acquired but active or passive? Active or passive? Repeated infections and immunity, what is that? Yeah, very good, Suresh. Breastfeeding, through breastfeeding, natural. Okay, fine. Okay, chicken pox, very good. Good example, Ariga. Is it? Yes, that is also active. Very good. Is it natural or is it this one, artificial? Natural or artificial? Natural or artificial? Actually, do you know the concept? Acquired immunity, active, passive. Okay, I'll give you an option. What is that? Antibody. Okay, antibody function. Suppose if we are giving an antibody, immunoglobulin IgG we are giving to a person and person got immunity. What kind of or what type of immunity is that? Active or passive? Active or passive? Very good. That is the point. If a person is getting immunization through antibody, IgG antibody we are giving, that means it is passive but artificial passive immunity. So here artificial acquired immunity, it is related to Vaccines. It is related to vaccine. Vaccine induced immunity. So if it is through from mother, that is natural. Okay, fine. Okay, fine. Next one. A technique used to sort and classify cells by using fluorescent marker on their surface is called. Fluorescent marker on their surface. Fluorescent marker on their surface. Never confuse with staining. Never confuse with staining. Okay, it is not staining. It is not staining. It's a fluorescent marker on their surface is called. Culture and a growth medium, not for identifying or sorting it, isn't it? Fine. Yeah. What is it? What is the answer? What is that? What is that? Have you heard about facts? What is facts? What is facts? Yeah, what is facts? Yeah. Fluorescent. 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 From the question itself it is there. Come on. FACS. Fluorescent. FACS. Nobody? What is the full form of FACS? Method tells staining method, fluorescent methods. Okay, we don't want that much deeper. We will go for one thing. What is that? FACS means fluorescent. Fluorescent activated cell sorting method. Cell sorting method. Fluorescent activated cell sorting method. That is what FACS. FACS. Fluorescent activated cell sorting method. One of the fluorescent activated cell sorting method is flow cytometry. What is that? Flow cytometry. Fluorescent activated cell sorting method. One of the classical example is flow cytometry. Flow cytometry. Cell sorting. Cell sorting and differentiating. We are differentiating one cell from the other. We are separating, segregating or segregating the tissues. That is cell sorting. One of the cell sorting method is fluorescent activated cell sorting method. One of the example is flow cytometry. So how about sequencing, genome sequencing? Genome. Here, genome sequencing. What is it used for? Genome sequencing. What is it? Genome, gene. What is that? Gene. So what is it? Why we are using that genome sequencing? To identify the entire cell gene typing. Entire cell genetic typing or gene typing. Genetic or gene. Entire gene typing or genetic typing. That is what we are using for this genome sequencing method. How about culture method? Culture method why we are using? To helping for growing. Okay. Then gram staining. Why we are using gram staining? Yeah. Yeah, color pigment. We know that differential and differential staining, gram staining, positive staining, negative staining, isn't it? Okay, fine. Then we have seen in TB, isn't it? Zeal-Nelson staining, isn't it? Ziel-Nielsen staining. Is it? That is a example of differential staining. What do you mean by differential? Differential means more than one dye is using. More than one dye they are using. That means differential staining. So staining we are identifying for the bacteria or organism which is present on the surface. Present on the surface. Present on the surface. Not on their surface. Got it? Not on bacteria surface. The bacteria or microorganism present on the surface. We have to identify it. We have to identify it. For that part we are using gram staining. Different methods of staining. Got it? So what is the answer? A technique used to sort and classify cells by using fluorescent activated cell sorting methods or fluorescent marker on their surface is called flow cytometry. Flow cytometry. Have you got the meaning? Have you got it? Okay, fine. Now, direct question. It's a direct question. Bacterial capsule is chemically composed of. What do you mean by capsule? What do you mean by capsule? What do you mean by capsule? Bacterial capsule. What do you mean by capsule? Bacterial capsule. Yeah, covering layer. What is that? The covering layer or outer layer. Covering layer or outer layer. So, which is made up of? Composed of polysaccharide or polypeptide? Polypeptide or polysaccharide? Are you sure? Polysaccharides. Polysaccharides are there in the capsule, bacterial capsule. Got it? So bacterial capsules are made up of polysaccharides. That was also a direct question. Okay, got it? Okay, fine. Who is the father of psychology? Who is the father of psychology? Or who is the father of experimental psychology? Yeah, father of psychology or father of experimental psychology, everything is Wilhelm Wundt. Then who is Ivan Pavlov? Conditional theory. Is it who put forward conditional theory? Classic conditional theory. Ivan Pavlov. Classic conditioning theory. Classic conditioning theory. Isn't it? Do you know that classic conditional theory? Ivan Pavlov. Dog, bell, food. That example. Yes, same. Ivan Pavlov. Classical conditioning theory. Then Alfred Binet. Who is Alfred Binet? Yeah, very good. Classic condition. Nandini, very good. Alfred Binet, father of? Wow, very good. Father of intelligence. Alfred Binet invented IQ test. What is that? IQ test invented by Alfred Binet. So he is the father of intelligence. Isn't it? Modern IQ test was put forward by Alfred Binet. And only one, Sigmund Freud. We know that. Psychoanalytical theory. Is it psychoanalytical theory was put forward by Sigmund Freud. Isn't it? Then who put forward iceberg theory, iceberg concept? Iceberg concept. Id ego, super ego. Then same, who is it? Sigmund Freud. Everything is by Sigmund Freud. Iceberg concept and id ego, super ego. Everything by whom? Sigmund Freud. Got it? Okay, fine. So what is the answer? Who is the father of psychology? Wilhelm Wundt. So the question can be asked, who is the father of psychology or who is the father of experimental psychology? Both the answers are same. What is that? Who is that? Wilhelm Wundt. Father of psychology or father of experimental psychology? Both are same. Got it? Okay, fine. Next. Okay, fine. So here, cognition includes the following except. Cognition includes the following except. So what are these cognitions? Cognitions includes cognition, knowledge, isn't it? Cognition includes knowledge, then perceiving, write it down. Knowledge. Cognition includes knowledge, perceiving, knowledge, perceiving, recognizing, yeah, very good, problem solving, recognizing, problem solving, Inka, attention, thinking, attention, thinking, yeah, Radhika, very good. M for memory, very good. Memory, attention, thinking, critical thinking, attention, thinking, memory, reasoning, yeah, decision making, conceiving and learning, yeah, judgment, thoughts, everything comes under cognition. So our question is, cognition includes the following except. Three options are examples of cognition. One is not. That is our answer. Except ante em kadu. Okay, fine. So here, decision making, is it cognition? Yes. Then reasoning, evolution, knowledge, belief and memory. Yes. Problem solving. Yes. But shaping? No. Shaping is not a cognition. So what is the answer? Shaping. Okay, fine. Next. The psychological factors involved in learning are. Which are the factors involved in learning? Yeah. What are the things we need? Intelligence, motivation, emotion, interest, attitudes. MM Kavali. Right. What are the things we need? Intelligence, motivation. So here intelligence is there, motivation is there. Motivation, intelligence, emotion, interest, emotion, interest, attitude, belief, values, 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 attitude, belief, values, and learning styles. Learning styles. These are the basic factors, psychological factors, which is helping for learning. Which is helping for learning. So, the psychological factor involved in learning are, which is it? What is it? What is it? What is the answer? What is the answer? Yeah, very good. Motivation and intelligence. Maturation. Maturation, it is a factor, but what maturation? Maturation of brain. Isn't it? Maturation of brain. It is necessary, but it is not a compulsory thing, isn't it? Even mental retardation students, they are learning some skills, isn't it? They are learning some skills. So it is not a mandatory one, but it is also a factor. Okay, fine. And coming to mental health. Mental health, even if it is not a good mental health, they can also learn, isn't it? And physical health, kavali, but it is not a mandatory one. It is not a mandatory one. Which is more important? Motivation and intelligence. Motivation and intelligence is more emotional, more learning factor that is related to psychology, psychological relation factor. That is maturation is physiological, it is psychiatry, that is also again physical. It is only related to psychology, Got it? Okay, fine. Coming to next. Fine. The function of the ego psychology, human behavior based on ego. Is it reality? Is it pleasure? Reality. What is that? So reality principle. Where is it? Reality principle. What is the principle of pleasure? What is the principle of pleasure? Principle of pleasure. Principle of pleasure. Principle of pleasure. Principle of pleasure. Id. What is that? Id. Principle of pleasure is id. And morality, sense of morality, principle of morality, super ego. Very good. Okay, fine. Got it? Super ego. So what is the right answer? Ego is under reality principle, and pressure principle is id, and the morality principle or sense of morality is super ego. What is that? Super ego. Got it? So what is the answer? Yeah. Okay, fine. So simple example. Okay, one boy is proposing one girl. That is very easy, isn't it? Yeah. One boy is proposing a girl. Girl will not propose always, isn't it? Always we have to propose, isn't it? Yeah, they won't take initiative, isn't it? Any suggestion? Fine. Okay. So here, one boy is proposing a girl. One boy is proposing a girl. So that girl just rejected. Always, obviously. First they will reject, isn't it? Later, tarvata mana try cheste. Yes. Chala try cheyali. Avane kada? Fine. First, even though they are liking us, but they won't accept at first price, isn't it? First they will reject. Then later, why are you not coming after me? They will ask, isn't it? Why you are rejecting me? Like that they will ask later. Okay, fine. So here what happens? One boy is this one proposing one girl. One boy is proposing one girl. So here girl is rejecting. At that time, boy thinks that, okay, it is her privacy, it is her life, I have to take care of my life and I have to leave. She said no. No means no. No means no. What is it? This is called? It is called ego. Reality. It is called ego. Reality. We understand the reality. What is that? We understand the reality. But he is proposing again and again, and he is convincing the lady, and at last the lady says yes. Okay, now he is in a pleasure mood. He is getting pleasure each and every time whenever he is proposing her. He is getting more pleasure. He is getting more pleasure. He is getting more pleasure, and the girl just accepted. So at that time he is in a pleasure principle. It is for why he did it. Why he did it? Only for his pleasure. Only for his pleasure, not for her. Not for her, isn't it? At first place, he tried it for his pleasure. Got it? What is that simply? Pleasure principle. What is that? Pleasure principle. What is it? Pleasure principle is id. What is super ego? Sense of morality. Sense of morality. Sense of morality. After they became the ideal couple, ideal loving couples. Okay, the first meeting, first date or first meeting, they are on the table, and the other side, this side. Okay, and the boy offered a coffee. She accepted it. Yes. Okay, and the boy asked, "Can I touch you?" Yeah. No. Okay. No. Okay. No. Okay. No. Okay. No means they should no. Don't touch it. Here he forcefully touching her, holding her hands. She is refusing it. And at first place he asked the permission and touched. Now he didn't ask, he touched. What is the difference? First he asked, then she denied. I don't want a touch. Okay. Second, he didn't ask, he directly touched. Got it? After a 10-15 minutes or a half an hour conversation, he directly touched. She didn't do anything. She is also holding his hands. What is it? Yeah. First she told no. Then she didn't touch. That is morality, social morality. He just followed the social morality. Got it? So before touching, he asked the permission. Can I touch you? That is called morality. Without asking, he touched and she accepted. Both of their pleasure reality. Pleasure principle. What is that? Pleasure principle. Got it? And reality principle వస్తుంది ఎప్పుడు yeah తర్వాత okay got it. So what is the answer? Reality. So reality principle is ego, and pleasure principle is id, and morality principle is super ego. So what is normal? Ego, id or super ego? What is normal? Normal has to be reality. Ego. Got it? Okay, fine. Okay. Next question. Okay, which of the following best describe sociology as a subject? Sociology as a subject. Which is describing sociology as a subject? Study of economics. Is it related to sociology? Study of social interaction. study of culture. Third option. What is the third option? Study of individual behavior. Okay, study of individual behavior. Study of individual behavior, study of culture, study of economic, and study of social interaction. Social interaction. Study of economic is not a sociology. What is it? It's economics. It's economics, isn't it? It's not sociology. And study of social interaction. Study of social interaction, it's a component of sociology. It's a component of sociology. Study of culture, it is also a component of sociology. Both of these are components. These are components or pillars. Components or pillars of sociology. But the question is, which of the following best describes sociology as a subject? As a subject. As a subject. What is it describing? The study of social interaction. The study of social interaction. The study of social interaction, that indicates it as a subject. As a subject. We are studying as a subject, that it meant that it is a science or science of or study of social interaction. Sociology is a science of or study of social interaction. And social culture and behavior, individual behavior, all these are components. Individual behavior and culture are components, but the study of or the science of social interaction, that is meant as subject. It is meant as a subject in a particular course. It is meant as a subject by defining as study of, science of social interaction. But behavior, individual behavior or culture, is these are the pillars, components. Got it? Okay, so what is the answer? Social interaction. The study of or the science of social interaction. Okay, fine. Next, social stratification. Social stratification. What do you mean by strata? Strata. Even in research also you discussed, isn't it? Strata. Stratification. Strata. Making into subgroups. Making into subgroups. Stratification. Making into subgroups. That is called strata. Stratification. Okay, so classification of society into caste. Is it a stratification? Sociology into caste. Society, classification of society into caste. Different caste. Upper caste, lower caste, middle caste. Isn't it? Is it a stratification? Is it a group division? Society is classified into subgroups. Is it right or wrong? Strata means, strata, the word strata means stratic, means subgroups. Subgroups. Strata means subgroups. Society dividing into subgroups on the basis of caste. Is it right or wrong? Is it right or wrong? Is it right? Yes. Next one is classification based on economy. Classification based on economy. Is it a strata? Don't say no. High class, high economic persons, poverty, below poverty, average. Unda leda? Above poverty, below poverty. Unda leda? Undi. Adu kuda undi. But comparing to this, this is more existing. This is more existing. Is it? This is more existing. This is also there, but compared to this, this is more existing. Isn't it? So even in social economic also there have high cost, low cost economic, high class economic. Isn't it? There are stratification. Classification based on power. Classification based on power. Political power. Unda leda? Adu kuda undi. Fine. Existence of group and intergroup. Group intergroup unda leda? Adu kuda undi. So every answers are right. But one is more common. What is that? Yeah, caste stratification. Voice stuck అవుతుందా? Is it clear now? Is it okay? I think there is a network issue. Network down ఉంది. Okay, clear. Is it clear now? Okay, fine. So what is the exact answer? Exact answer. So this social stratification means existence of group and this one what subgroups, but among that which is the most commonest existing thing? Classification of society into caste. Classification of society into caste. But the meaning, exact meaning of strata means subgroups. Strata means subgroups. Have you got it? Have you got the meaning? Yeah, fine. Okay, next. Voice break. Come on. Okay, fine. So is it okay? Is it okay? There will be network issue. Okay, fine. So next question, which of the following is a characteristics of culture? Following characteristics of culture. What are the characteristics of culture? What are the characteristics of culture? A culture should have beliefs. Isn't it? Undali kada? Yes. What are the factors? Just write. Belief. A culture should have belief. Then behavior, belief, behavior, learned, values, material object, and shared. So what are the characteristics of culture? It has to be values, beliefs, behavior, learned, and material objects plus shared. All these are the characteristics of culture. So options. Culture is learned. Is it right? Yes, it's right. Culture is divine creation. Is it a divine creation? No, it's created by man. Isn't it human? And culture makes human life materially comfortable. Is it a material comfortable? No. Only ideology. Fine. Culture is religious and ethical system. It is religious but not ethical system. It is religious. Culture is religious but not a religious ethical system. Isn't it? It is not a religious ethical, but it is religious. Culture is also a religious, but it is not a ethical system. Isn't it? Is it an ethical system? Ethical. Ethical means there must be justice. Culture. Culture and justice. Culture and justice. See, some, for example, one boy and girl from different caste, they love. Will the society accept? So justice, is it there? Justice? Got it? So it is not an ethical system, but it is religious. Got it? Culture. Fine. Ethics comes in few situations. Only in few situations. Ethical system comes in only few situations, not everywhere. Got it? Okay, fine. So what is the answer? What is the answer? Culture is learned. Culture is learned. That is right option. Are you still having that stuck issue? Are you still having stucking issue? Check. Online check. Message. Wait, 1 minute. Stucking, man. There is stuck. Voice is stucking. See. I think it is not about voice. It is about network. It is about network. Okay. Okay, is it okay now? Is there still the voice problem? Or is it clear? How is it now? Am I audible? Okay, shall we start? Okay, shall we continue? Yeah. Vanilla, that will be considered. Offline students are doing so much of noise, sir. Okay, I'll let them know. Let them know. They are not all of them. Some of them. Yeah, some of them are very noisy. They need to talk in between. It is their character. We can't change it. Okay, they won't keep silent. Okay, they need to talk in between the classes. See now itself. How many of them are talking? See. Yeah. Okay, whoever not want the class, just get out. Otherwise, please keep listen here. Don't talk in between. Got it? Okay, fine. Don't spoil the mood of the class. Okay, fine. If you want to talk in between, you can come here and talk. I will take the class. You can talk here. Okay, don't talk in between. If you want to talk in between, go out and talk and come. Nobody will stop you. Okay, got it? It is your convenience and comfort, but don't spoil others, because there are many of students outside, isn't it? So don't spoil others. If you want to spoil yourself, go out, spoil yourself. Nobody will question it. If you want to become more efficient, stay here, be calm. Got it? I got the point? Okay, fine. So listen here. So when the International Nurses Day celebrated day. When is it? Yes, that is on. So when is the week? International Nurses Week. From when to when? From when to when? Excuse me. Do you want to sit here or go out? Don't talk in between. Got it? You, I'm pointing you. Got it? Do you got my point? Okay, fine. So when we are celebrating Nurses Day, International Nurses Day? Yeah, 12th May. So when is the International Nurses Week? From when to when? From when to when is the International Nurses Week? May? It starts from May 7th. Very good. It starts from May 7th. May 7th onwards starts what? International Nurses Week. International Nurses Week. Why we are celebrating International Nurses Day on 12th May? Yeah, very good. Because that is the birthday of Florence Nightingale. Who is Florence Nightingale? Florence Nightingale, who is he? Who is she? Yeah. Florence Nightingale is the founder of modern nursing. Modern nursing founder. Florence Nightingale. She was born. She was died. When she was died? 1910. So in 2 years back, 2-3 years back, we celebrated her 200th death anniversary. When was it? Which year? 2000? 2030 ఇంకా అవలేదురా question. Okay, so when we celebrated Florence Nightingale's 200th death anniversary, that is a question. 200th death anniversary, when was it? She died on 1910 August 13. Okay, so when will become the this one 200? Not 1910. Okay, fine. 2010. Yeah, find it out. Okay. Yeah, in 2020, isn't it? 2020. It was in 2020. That was 3010. Samiksha, not 3010 ra, already అయిపోయింది. 200th death anniversary we already celebrated. 3010 ఇంకా అవలేదు. Only we are in 2023. Okay, fine. So, what is the answer? When we are celebrating International Nurses Day? Yeah, 12th May of everywhere. Every year in the memory of Florence Nightingale's birthday. Okay, fine. Next one. So the four fundamental nursing are. Okay, what are the four fundamentals of nursing? Assessment, diagnosis, planning, implementation, evaluation. Isn't it? Okay, fine. There are five. So here four fundamental nursing care are assessment, diagnosis, care plan, medical intervention. Is it medical intervention or nursing intervention? Nursing intervention. Okay, fine. Communication skills, assessment, nursing skills, nursing intervention. Assessment, nursing skills, collection of data and treatment. History taking, assessment, collection of data, validation of data. Four fundamentals of nursing. In that, is there any communication? It's a skill of a nurse. Communication, especially community nurse. Isn't it? Especially community nurse, but all the nurses should have communication skill. But is it there in four fundamentals of nursing care? Is it there? Yeah. What is it? So what is the right option? A or B? A. Are you sure? B. Why B? Why not? Why A? Why B? Tell me why A? Why B? Communication skills, assessment, nursing skills, nursing intervention. In four fundamentals of nursing skills kavala udda. Fundamentals, four fundamentals. Nursing skill అంటే ఏంటి? Nursing skill to perform any type of procedure, or action. Got it? That is we can say as skill. Nursing intervention, assessment kavali. Nursing skill kavali, but it is whether it is comes under fundamental 4 or not. That is the point. Whether it is comes under fundamental 4 or not. That is the point. That is what question. Okay. And history taking. That is what called data collection. Assessment, collection of data, validation of data. These are not 4. Okay. Everything is related to data collection. Only assessment, nursing skill, collection of data and treatment. Nursing skill, assessment is there. Collection of data, is it there? Collection of data, where it comes? Collection of data, it comes in initial assessment. Already assessment given, then collection of data. Already 2 అయిపోయింది. Nursing skill, treatment మనది కాదు. Got it? So that is also not the nursing. Only thing here is nursing intervention, but here only thing is medical intervention. Okay, but there communication and nursing skills. So this is not comes under first 4. This is not comes under first 4 fundamental rules. So in that case we can go for option A. Got it? This is what the question is. Whenever there is question, more suitable answer. Which is the more suitable answer? So you may question, sir, medical intervention manadu kaadu. Yeah, but how about here? How about here? Communication skill, nursing skill. That doesn't comes under fundamental for nursing care. Got it? Under 4 fundamentals, it doesn't come. So here, it is more suitable. It is more suitable. That is what? Among these two options, which is more suitable? Option A. Option A is more suitable. That is the answer. That is the answer. Okay. This won't come because yeah, confused question. That is what, Jodi. That is what the question is. Question will be simple, but two options, really you will be confused. At that point, we have to consider which option is having high or little more weightage. That is what called critical thinking. Got it? For generating that critical thinking, we are practicing that kind of questions. Have you got it? Got it? Yes. Have you got it? Yes. Yeah. It's 200th celebration, 2020 we did it, isn't it? 2020 it is that anniversary. Sorry, it is not death, it is birth, I think. Yeah, it is birthday, 200th birthday, not death anniversary, 200th birthday, 200th birthday, not death anniversary, 200th birthday, 200th birthday, we celebrated. Okay, that was we celebrated. Okay, fine. Yeah, birthday. Okay, not death anniversary, 200th birthday we celebrated. Okay, fine. Sorry. Fine. Here. So what is the little more suitable answer? Little more suitable answer is A. Okay. So don't look at here. So here maybe the answer key may be this one, but that is not the most suitable. Most suitable is A. Most suitable is A. Got it? Okay, next question. Important question. Yesterday also we did it. One question, isn't it? What is that? What is the important question? Yeah, drug calculation. What is that? 500 ml of IV fluid we need to administer over 5 hours. Drop factor is 20. Drop factor is 20. So how much drop we are giving per minute? In 1 minute, how many drops we are giving? So what is the answer? 33. అందరికి 33 వచ్చిందా తెలుసా ఎట్లా చేయాలి తెలుసా చెప్పాలా Okay, so listen here. What is the formula? Formula is total fluid in ml. Total fluid in ml divided by total time in minutes into drop factor. So here fluid anta 500 ml unda leda undi 500 ml divided by total time in minutes. ఇక్కడ ఏమున్నాయి 5 hours ఉన్నాయి. మనం ఏం చేయాలి? కన్వర్ట్ చేయాలి. 5 hour into 60. 1 hour means 60 minutes. So 5 hour means 5 into 60 minutes. Got it? We convert it into minutes. Into drop factor anta 20. So here we'll go 5 into 60. 5 into 60 300. Isn't it here? 500 into 20. 0. 2 into 50. 100 divided by 3. 100 divided by 3. 33.3333333333. So what is the answer? 33. Here 33 drops, 32 drops, 34 drops, 35 drops. So ఎంత ఇవ్వాలి? 33.33333. So how much we should give? 33 drops. Got it? 33 drops. I got it? Yes, next one. So what is the answer? 33. Next one. A patient admitted with the gout. Patient has admitted with gout. The nursing assessment reveals which of the following? Patient के उन्हें gout. What is gout? What is gout? Excessive deposition of, isn't it? Excessive deposition of uric acid. Gout means excessive deposition of uric acid. Most commonly, it will deposit in extremities and toes. Extremities and toe. Most common site of accumulation of uric acid is great toe. Where? Great toe. There will be a node like structure. What is that called? What is that called? What is that called? What is it called? Uric acid deposited in the great toe. There will be a node like or a growth like structure. What is it called? What is it called? What is the name of that? What is the name of that? What is it? Pruritus. What is it? Huh? No. 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 What is it? What is it? Crystals, uric acid crystals will form, but what is it? The foot, great toe kada. This is the foot of the patient. This is the great toe. So here what happens? One node like structure. What is it called? What is the name of that? Swollen or nodule like structure. What is it? What is the name of that? Arthritis and itis and inflammation. Arthritis and joint inflammation. Edo okati chepta. Sir, something is better than nothing. Okay, I didn't give any answer. Something I'll give. No. Yeah. Chapati Sara. Clue wala. It's a node. It's a node. Which node? Which node? Acellular node? No. No, Nilavadi, no. Paronachia. Entra paronachia. Nike, it is related to nail. Koilonychia, paronachia, it is related to nail, not joint. So find it out. Homework. What is the node called? Node called in gout. In gout, a node formation at the great toe joint. What is it called? That is another homework. Okay? Homework. Find it out the name. No, don't forget to do a homework. Okay? ఇప్పుడు ఎక్కడ నుంచి వచ్చింది ఫోన్లు చూసినావా డోంట్ డూ రీడ్ ఫ్రమ్ టెక్స్ట్ బుక్ ఫైన్ ఇట్ ఈస్ కాల్డ్ టాఫీ ఇస్ ఇట్ ఐ రీడ్ అబౌట్ ఇట్ టాఫీ దట్ ఈస్ కాల్డ్ టాఫీ వెరీ గుడ్ దట్ ఈస్ కాల్డ్ మహేశ్వరి ఓకే ఫైన్ దట్ ఈస్ కాల్డ్ టాఫీ okay that is called toffee. This nodule is called toffee. Why because deposition of uric acid. So here what is the nursing intervention or assessment? Is it abdominal pain? No. Is it flank pain? Abdominal pain means it is here. Flank pain means it is this area, flank area up to here. This is flank area. And shoulder pain, it is here, shoulder pain. It is also not a classical sign of gout. Classical sign of gout is swollen at great toe, and that is called as toffee. What is that? Toffee. That is called toffee. So what is the answer? Yeah, what is the answer? Swollen great toe, isn't it? Okay, fine. Next one. We'll move on to the next. So what is the size of a needle we are using for insulin injection? What is the root of insulin injection? Subcutaneous. Subcutaneous is the root of insulin injection. So 22 gauge and 1.5 inch long. That is for IM. 22 and 1.5 inch long. That is also for IM. And 18 gauge. 18 gauge is always for. That is also for IM. 18 and 1.5. Even we can use it for IM and as well as subcutaneous. IM and subcutaneous we can use it. Okay, but it is longer one. But it is longer one. Very longer one. Got it? Okay, fine. So ideal insulin injection needle size is about. Got it? Got it? Got it? Yeah. Shall we move on to next? Yes. Okay, next. Next one. What nursing action is appropriate when obtaining a sterile urine specimen from an indwelling catheter to prevent infection? To prevent infection. So, for preventing infection, what are the basic things? What is the first basic thing? Preventing infection, hand wash. Second thing, PPE, personal protective equipment. These are the basic things for preventing infection. Hygiene. First thing is hand hygiene. Second thing is personal protective equipment. Then aseptic techniques. These are the main three things we can use it for preventing infection. So what is the question? A patient is having Polish catheter and nurse need to collect urine sample from that, but it has to be preventing the infection. The first concern is the method of prevention of infection. That is the exact question. Have you got the meaning of the question? Okay, fine. Here, aspirate urine from the tubing port using a sterile syringe. Cheyali kada? Yes, atlane cheyali. Okay, fine. Then open the drainage bag and pour out urine. No, never do. And disconnect the catheter from the tubing and get urine. Okay, fine. So here, idu cheyali, idu kuda cheyali. Use of sterile gloves when obtaining urine. Okay, idu cheyali, idu kuda cheyali. Okay, two things can be done. But which one is more preventing infection? Personal protective equipment. After hand wash and PPE, gloves, isn't it? So which is having more prevalent, more weightage for which option? Yeah, D option. Got it? Have you got the meaning? Have you got it? Aspirate urine from the tubing port using a sterile syringe. That we can do it, isn't it? Yeah? Yeah, option D. This is the first thing. We have to do. This is at the time of aspiration. At the time of urine aspiration, we should do with sterile syringe. But before that, prevention is first thing, isn't it? Before doing this, what we are doing? Hand wash and sterile gloves, isn't it? That is the first thing we are doing for preventing infection. So what is the most suitable answer? Yeah, PPE. Using PPE. That is the most one. After hand wash, second method of prevention is using of PPE. What is PPE? Personal protective equipment. Have you got the meaning? Have you got it? Okay, fine. Okay, next. So a scrub nurse in the operating room has which responsibility? Scrub nurse em cheyali. Scrub nurse. What are the functions or responsibilities of scrub nurse? Em cheyali. OT arrange cheyali. Is it patient? Scrub cheyali. Then articles are there or not? Is it rectify cheyali? Identify cheyali. Then OT nurse information ఇవ్వాలి ఏమంట ఓటీ ఇప్పుడు క్లియర్ లేదు, డిస్ఇన్ఫెక్షన్ చేయలేదు, అన్ని చేసి పెట్టండి. గాట్ ఇట్? అన్ని ఇన్ఫర్మేషన్ పాస్ చేయాలి. ఎవ్రీథింగ్ ఈజ్ స్క్రబ్ నర్స్ రోల్. దెన్ డ్యూరింగ్ ద టైమ్ ఆఫ్ సర్జరీ సర్క్యులేట్ ద things to the surgeon, isn't it? All these are the functions of scrub nurse. So now we will go to the question. Okay, a scrub nurse is in the operating room has which responsibility? Assisting with the gloving and gowning, donning, doping. That is circulating nurse can also do it, isn't it? Okay, next, positioning the patient. That is also can be done by other team. Assisting the handling surgical instruments to the surgeon. Yes, very good. Applying drapes, that anyone can do. Either applying drapes, or either circulating nurse or scrub nurse, both of them can do, isn't it? See, the ideal role of scrub nurse from these options is, I got it? I got it? Yes. So next one. We'll move on to next. Okay, fine, very good. Direct question. It's a direct question, isn't it? Which of the following white blood cells WBC counts indicates leukocytosis? What do you mean by cytosis? Cell level ఎక్కువ అయింది, ఇంక్రీస్ అయింది, ఎక్కువ తక్కువ అంటే పీనియా. పీనియా. సైటో అంటే సెల్, సైటోసిస్ అంటే సెల్ ఎక్కువ, సైటో పీనియా. పీనియా అంటే తక్కువ. ఏం తక్కువ? సెల్ తక్కువ. సో వాట్ ఈస్ ద నార్మల్ రేంజ్ ఆఫ్ డబ్ల్యూబీసీ? 4,500 to 11,000. That is the normal range of WBC. So here 7,000 ఎక్కువ ఉందా, నార్మల్ ఉందా, తక్కువ ఉందా? నార్మల్ గా ఉంది. ఓకే, 25,000 ఎక్కువ అయింది. ఓకే, ఫైన్. 10,000 నార్మల్. 4,500. సో వాట్ ఇస్ ఆన్సర్? 25,000. So if the option is 2,000, then what does that mean? Leukocytopenia. Leukocytopenia. If the WBC count is 2,000, that is termed as leukocytopenia. Penia. Takwa indi. Got it? Okay, fine. Fine. So which of the following is not a scope of first aid? Not a scope of first aid. So first aid, what are the scopes of first aid? First aid, what are the scope of first aid? Yeah, just right. Preserving life. Just right, just right. Other than that, any option they can give. First one, preserving life. Preserving life. Preserving life. Preventing injury from worsening. Preventing further injury or preventing injury from worsening. Preventing injury from worsening or preventing further injury. Both are right. Okay, preventing further injury or preventing injury from worsening. Another scope, aiding in recovery. Aiding, AID, aiding in recovery. Aiding recovery. Aiding in recovery. Aiding in recovery. Aiding in recovery. And protect unconsciousness. Protect unconscious. Protect unconscious. Unconsciousness or unconscious patient. Protect unconscious patient. These are all comes under the scope of first aid. Scope of first aid. So here diagnosis. Diagnosis cheyala vada? Without diagnosis, how will you give first aid? Isn't it? Cheyali kada? Yes, it should be done. Okay. Treatment. Ivali. Treatment ivali. That is one of the scope. Promote recovery. Yes, promote recovery. Recovery promote cheyali. So disposal. Em dispose cheyali? Patient and dispose cheyala? No. Okay, disposal is not a scope of first aid. Okay? Yeah. So next one. Okay, next one. In a hospital setting, which of the following is stranded after cardiac arrest? After cardiac arrest, patient is where? Patient is in hospital setting. Patient ekkada? Patient ఇప్పుడు హాస్పిటల్ సెట్టింగ్స్ ఉన్నాయి. అప్పుడు పేషెంట్ కి ఏమైంది? కార్డియాక్ అరెస్ట్ అయింది. అప్పుడు ఏం ఇవ్వాలి? వాట్ ఆర్ ద థింగ్స్ యూ విల్ టేక్ ఆఫ్? ఓకే ఫైన్. కార్డియాక్ ఎంఆర్ఐ. కార్డియాక్ ఎంఆర్ఐ ఎంతాడా? అప్పుడు అరెస్ట్ అయినప్పుడు ఎంఆర్ఐకి పంపించాలా? నో. ఓకే ఫైన్. నాలెక్సోన్ ఇన్ ఏ పేషెంట్ విత్ కొరోనరీ హార్ట్ డిసీజ్. నాలెక్సోన్ మనం ఇస్తారా? ఏమి ఇస్తారు? మళ్ళీ మోర్ఫిన్ ఇస్తారు. Isn't it? Naloxone ఏంటి? Antidote of morphine. Antidote of morphine is naloxone. Isn't it? That is not the answer. And here, naloxone in a patient with myocardial infarction. It is not a naloxone. It is also morphine we can give, but not for arrest patient. Not for arrest patient. The question is regarding cardiac arrest. For cardiac arrest patient who is in a hospital, what are the things will you do? We will start CPR and we will give shock defibrillation. So what are the things we can give? Chest compression and defibrillation. Got it? Shock and chest CPR. Got it? So what is the answer? Okay. Okay, now next one. Yeah. Okay, fine. What is it? In a person stop breathing in any of the following scenarios, resuscitation, that is basic CPR, may be required except among these conditions, in which condition we are not giving CPR? That is a simple question. Either breathe, is it a rescue breath or chest compression? Rescue breath or chest compression. Anything in among these 4 options, which option we are not giving CPR? That is the question. Okay, fine. So poisoning. For poisoning, basic CPR ivala udda. Rescue breath, isn't it? Rescue breath, open airway or rescue breath. That is one of the things we can give, isn't it? If there is respiratory arrest, we should give. If there is respiratory arrest, we should give. And to poisoning, huh? Smoking, yeah? What is that? Oh, smoke inhalation. Okay, smoke inhalation. Smoke inhalation. In smoke inhalation, that is also if it is indicated rescue breath or open airway, we should give. And coming to road accident and met with cardiac arrest, can we give? Yes, we can give. And obvious fatal injuries. In obvious fatal injuries, 2 concepts are there. If the mother is in danger, if the mother is in danger and baby already gone, baby already died and mother is in danger, only at that situation we can give. Only at that situation we can give chest compression. Otherwise, no. Got it? So what is the right answer? What is the right answer? Got it? Yeah. So what is the answer? Yeah. What is it? C. So only if the mother's life is in danger. Otherwise, we won't give in obvious fatal injuries. All of the situations We will give. Here also we will give rescue breath. Isn't it? Rescue breath and airway. Here also rescue breath and airway. If there is any cardiac arrest induced by poisoning, we can give. And road accident, cardiac arrest, we can give. Isn't it? But here fatal injury, baby already gone and mother is in very danger. At that position we can give. Got it? Got it? Okay. So what is the answer? Okay. Fine. Next one. The characteristics of a not called, oh yes, call conducted outbreak investigation. Call conducted outbreak investigation. For simple example, corona ochindi. Em ochindi? Corona. Appudu manam em chesina? Simple thought. Okay. With that we can think outbreak of corona. Manam em chesina? Okay, fine. So first thing, the case definition includes three categories: definite, probable, possible. Definite, probable, possible. Atla category unda? Definite case, probable case, possible case. At the time of outbreak. At the time of outbreak. Got it? Next, every case is a laboratory confirmed one. Cheyala vada? Cheyala vada? Manam chesnava leda? During corona, PT, RT-PCR and yes, rat test chesnava leda? Andarki chesnava leda? Yes, fine. A loose case definition is used during the analytical epidemiologic phase. Is it necessary? Is it necessary? Is it necessary? Option C. Is it right, the option? A loose case definition is used during the analytic epidemiology phase. Oh yeah, case definition. Okay, related to case definition. Yeah, fine. Case definition during the analytical epidemiological phase. Analytical epidemiological phase. Analyze cheyala vada? Cheyali, but that is not important during the time of outbreak, isn't it? And a few cases are laboratory confirmed and the rest of them meet the case definition. That we did it only at the end of the phase, at the resolution phase, not at the outbreak phase. Not at the outbreak phase, only at the resolution. At the end of the stage we did what? Symptoms unnaya. Is it manam em chesina? Announce chesina. Or those who are having these symptoms, just be careful, no need to worry, you have to do this and these things, that's it. We didn't do test, but that is at the end stage, not at the active outbreak stage. Got it? Not at the outbreak stage. So what is the answer? What is the answer? 30 questions. Em cheyali? Laboratory confirm cheyala vada? Every case is a laboratory confirmed. Every case should be laboratory confirmed, isn't it? Okay, fine. Next one. The role of nurse in emergency community response does not include. And enti? Does not include. There are three options. That is the role of community nurse in emergency. One is not. That is our answer. So direct victim to resources and community support. Direct victims to resources and community supports. Direct victims to community support. Whatever support we have, we are giving the care. Ivala the community nurse. Okay, cheyali. Continuously assess and monitor patients' physical and psychological needs. Continuously monitor cheyala vada? Yes. And then assist in first aid and triage patient needs. Who is having immediate care? Who is having little bit delayed care or late care? Atla triage cheyala vada? Their need. What is the important need? Isn't it? One patient fell with accident or injury, bleeding is there, and other patient is asking for, sister, I need on juice. So which need is more important? Bleeding stop cheyala, juice ibala. See that that also we have to triage it, isn't it? Need of the patient, we should triage it, isn't it? Okay, fine. At the time of emergency, fund mobilize cheyala. Yes. So which is the answer? Yeah, mobilization of fund is not a yes responsibility at the emergency community nurse. Got it? So what is the answer? What is the answer? Yeah, fine, very good. Okay, I got it. I got the answer. So what are the responsibility of emergency community nurse? What are these? First thing, provide first aid. Already it is here. Where? See, provide first aid. Just write the answers. Provide first aid. Provide first aid. Next, provide advanced clinical care. Provide advanced clinical care. Provide advanced clinical care. Provide, one of the thing is first aid, advanced, second one is advanced clinical care. Advanced clinical care. Advanced clinical care. And assess and triage victim. Assess and triage victim. Where is it? Here itself. Triage. Assess and triage. Assess and triage victims. Assess and triage on the basis of their needs. On the basis of their health needs. Health needs. Okay. Assess and triage. Assess and triage. Triage. It is here. Triage. Triage. Assess and triage. Assess and triage. Allocate scarce resources. Allocate scarce resources. That is what the first option. Direct victims to resources and community support. Scarce, 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 all the available resources, multiple resources. Okay. Resources. Okay. Okay. And ongoing physical and mental health needs. Ongoing physical and mental health needs. So these are the roles of a community nurse. Emergency community response. Emergency community response of a nurse. Emergency community response of a nurse. Got it? So దాంట్లో ఏమేమి ఉన్నాయి ఆప్షన్లు? రిసోర్సెస్ ఉన్నాయి, సైకాలజికల్ అండ్ ఫిజికల్ నీడ్స్ ఉన్నాయి, దెన్ ట్రయాజ్ అండ్ అసెస్ ఉన్నాయి. ఏం లేదు, మొబిలైజేషన్ ఆఫ్ ఫండ్స్ లేదు. Got it? Okay, so what is the answer? Mobilization of funds. Okay, now next one. Very good. Direct question, isn't it? So backbone of community health nursing is called home visit, isn't it? What is the backbone of community health nursing? Enduku, why it is became backbone of the home community health nursing? Why it is becoming backbone? Because అందరూ ఎక్కడ ఉన్నాయి? Everybody is in family, everybody is in home, isn't it? So a community health nurse can give a home visit to assess each and every individual, family and community. So what is the backbone of a community health nursing? Home visit. What is it? Home visit. Got it? So which is the right answer? Home visit. It's a direct question. Okay, fine. So to implement an effective and efficient referral system, a combination of factors is essential except. So ఏమేం కావాలి? There must be coordination. Between referral and referred centers. Referred and referral center, there must be coordination. Next ఏం కావాలి? What should be there for referral system? ఏం కావాలి? మెకానిజం కావాలా? టూల్స్ కావాలా? protocols కావాలా? Yes, everything is necessary, right? Mechanism, tools, communication, feedback mechanism, right. Feedback mechanism, transportation system. Yeah. Starting is Raledada. Enduku? Em chesina? Okay, fine. So, an effective and efficient referral system should have coordination with the referred and referral centers, transportation system. Next is transportation system. They should have a transportation system. They should have protocols. They should have protocols. Trained personnel. There should be mechanisms, tools, communication and feedback system. There must be transportation system, protocol, trained personnel, coordination, mechanism, tools, communication, feedback system, policy, isn't it? Policies. Okay. And how about social influence? Social influence kavala udda? Actually, at particular stage social influence is needed, but as compared to all these other factors, social influence is not that much important for a referral system. Social influence is not that much important for a referral system, but it dan kuda kavali. Social influence also needed, but it is not that much important as compared to other basic functional properties. So these are all mechanism, tools, communication, feedback system, coordination between a referred and a referral center, transportation system, protocol, trained personnel, policies, transportation system. Everything is a inevitable part. Inevitable part means it should be there. That means it should be there for a reference system. So here the question is for implementing an effective and efficient referral system, a combination of factors is essential. Except. So all these are factors of referral system. That is the point. That is the trickiness in the question. All these are factors of referral system. With these factors, what combination we need for referring it? That is, we know that except which is not necessary. That is the exact question. Have you got the meaning of the question? We have some factors, and as a combination of that factors we can implement a referral system, but one is not that much necessary. And what is that? Yeah, what is that? Answer. What is the answer? So here one word is there. That is what I told you. There is a trickiness in the question. To implement, I told you these all are the basic factors. For implementing all these things, one thing is not necessary. For referring one area to another area, one is least concern. All these factors should be there, but one factor is least concern. But for implementing implementing this reference system, social influence kavala udda. Suppose you are referring one hospital to another hospital. Minister is calling, hey, one of my relatives coming, take care of it. Influence kavala udda. For implementing it, for implementing this referral system, social influences kavala udda. Yes, it is having a role. It is having a major role. So in that situation, among this factor, one of the factor is not necessary or least important. Or least important. What is that factor? That is the question. If you are have you got the question? Yes. Now answer it. Now answer it. What is that? No. What is least concern? What is least concern? Least concern for referring one area to efficient referral system. Least concern. Least concern we can go for tools, mechanism, communication and feedback mechanism. It is least concern. It is least concern. Other transportation system, protocols, trained personnel, coordination, everything, social influence, everything is prior concern for what? For implementing. There is a trick. The entire question, here comes the trickiness. I got it? There they will confuse you. I got it? I got it? Okay, fine. As per the factors, social influence is the least factor. But for implementing, social influence becomes one of the priority factor and these tools becomes least prior factor. Have you got the meaning? So that is how to approach these type of questions whenever there is this kind of trickiness. Got it? Okay, fine. Social influence, no, let it be. It is not. That is the most concern answer. That is the most concern answer. Okay, fine. Fine. Next. The time period between infection and detection of antibodies. What is the meaning of that? What is the meaning of that? Time period between infection. ఇప్పుడు HIV మన బాడీలో వచ్చింది. HIV మన బాడీలో వచ్చింది. ఓకే, వచ్చింది. ఎక్కడ? ఎట్లా? మెట్రోలో వచ్చిందా? ఎట్లనో వచ్చింది. ఫైన్, ఫైన్. And detection of antibodies against HIV. Detection, that means we are diagnosing. What is that time period? What is that time period called as? Against HIV. That is known as window period. What is that? Yeah, window period. What is the meaning of the question? What is the meaning of the question? Yeah, very good. Already microorganism entered in our body and there is a time period or there is a time gap for diagnosis of HIV. That gap is known as window period. That gap is known as window period. It is not acute infection, it is not chronic infection, it is not active HIV. So what are the window period? So window period, it is differ from different techniques, different method. Which method we are using, based on that the window period will be different. Okay, just write about HIV window period. HIV window period. Just write few points. HIV window period. First one, NAT test. First one, NAT test. Nucleic acid test. Nucleic acid test. NAT. NAT test. Nucleic acid. Nucleic acid test. NAT test. What is the window period of NAT test? NAT test. NAT test, the window period is 10 to 33 days. Enta 10 to 33 days. 10 to 33 days window period. Okay. Next test, antigen antibody test. Antigen antibody lab test. Antigen antibody lab test. Antigen antibody lab test. So for antigen antibody lab test, what is the window period? 18 to 45 days. Enta 18 to 45 days. All this we are talking about HIV. Different tests we are using for identifying window period. For NAT test, nucleic acid test, what is the window period? 10 to 33. For antigen antibody lab test, what is the window period? 18 to 45 days. Next one, rapid antigen antibody test. Rapid antigen antibody test. Rapid antigen antibody test. Rapid antigen antibody test. So window period anta 18 to 90 days. 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 Then one more test is there, antibody test. Antibody test. Antibody test, the window period for HIV is 23 to 90 days. 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 Got it? Got it? 23 to 90 days. Okay? I got it? So what is the answer? What is the answer? The period between infection and the detection against antibody in patient against HIV, that is known as? It is known as window period. It is known as window period. Okay, fine. Next, we'll move on to next. Okay, fine. Epidemiological tool of measurement. Epidemiological tool of measurement. What are the epidemiological tool of measurement? What are the epidemiological tool of measurement? What? A and C same, huh? Okay. A, C and the frequency and distribution. Okay. Frequency and distribution. Frequency and distribution. So what is the answer? Huh? Oh. Okay. Rate, ratio and proportion. Rate, ratio and proportion. These are the options. Okay. Yeah. What is it? Okay, difference between window period and incubation period. Okay, what do you mean by window period and incubation period? Window period already we discussed. What is incubation period? Already microorganism entered, it needs to colonize and start first sign and symptom. Start first sign and symptom. Here in window period means the HIV organism entered and we are detecting it, we are diagnosing it. The time of diagnosis, that period is called window period. The microorganism entered and it is showing the first sign and symptom. That is called incubation period. Have you got it? Have you got the difference? Got it? I think who asked it? Yeah, Uma Devi. Susmita, Uma Devi. Have you got it? Okay, fine. So coming to this question, epidemiological tool of measurement. What are the epidemiological tool of measurement? There are three tools. Which are they? Frequency. What is that? Frequency. So three things comes under frequency. Frequency. Different frequency scales are rate, ratio and proportion. Rate, ratio and proportions are frequency scale which is of epidemiological tool. But you write the answer. You write one more answer. Epidemiological tool. Frequency frequency, association, and potential impact. Frequency, association, potential impact. These are generally we termed as epidemiological tool of measurement. Which are the frequency, association, potential impact. So here association and impact is not there. Association and impact is or potential impact is not there. Only thing we can see the different measures of frequency. What is that? Rate, ratio, proportion. Rate, ratio, proportion are different types of frequency. What are the types of measurement epidemiological tool of measurement? Frequency, potential impact, association. Frequency, association, potential impact. These three are the epidemiological tool of measurement. In that, here we go, there is no incidence is not, prevalence is not, frequency and distribution. It is not distribution, it is frequency, association and potential impact. There is no distribution. That is why this is not the answer. Frequency is there, but distribution not a tool of epidemiology, tool of measurement. And so this is also not the answer. Rate, frequency and proportion. Okay. Already it is here, right? So which is one more option? Sorry, rate, ratio. Okay, rate, ratio and proportion. So frequency itself meaning rate and ratio. So proportion is not there. We can see frequency, association, potential impact. These three things are the epidemiological tool of measurement. Out of that, frequency is of three types. Which are there? Rate, ratio, proportion. Or with rate, ratio, proportion we can identify frequency. Got it? So what is the exact answer? Got it? Rate, ratio, proportion. Rate, ratio, proportion. Got it? Okay, rate, ratio, proportion. Okay, fine. Minor elements. Which are the minor ailments? Back pain. Is it a minor element? Yes. Headache. Is it a minor element? Yes. Nasal congestion. Is it a minor element? Diarrhea. Is it a minor element? Yes. So do not include back pain. It's a minor ailment. Headache. It's a minor ailment. Nasal congestion. It's a minor ailment. Which is not a minor element? Yeah. Stroke is a major. Okay, inke minor ailments. What are there in minor ailments? Yeah, insect bite. Isn't it? What else there? Insect bite, diarrhea. Isn't it? Insect bite, diarrhea. Then pyrosis. What is pyrosis? Very good. Heartburn, or we can say pyrosis. Other terminology for heartburn is pyrosis. All these are minor ailments, which is not a minor ailment. Stroke is not a minor ailment, it is a major one. Got it? Okay, fine. Next. Okay, which one of the following is an environmental risk factor? Environmental risk factor. What are the environmental risk factors? Examples of environmental risk factors. pollution. Isn't it? One of the environmental risk factor is pollution. What type of pollution? Water pollution, water pollution, air pollution, noise pollution, every pollution. Okay, fine. Out of other than that, radiation, pollution, radiation. Then one more thing related to land area. Land area. What is that? Land area pattern. Land area pattern. That means rural, urban, isn't it? That is also comes under environmental factors. Land area pattern. Then climate change. Climate ante weather. Okay, fine. Climate change. Danni ekkada vastadi? Danni. Yes, very good. Everything comes under environmental. Everything comes under environmental risk factor. So, question is, which one of the following is an environmental risk factor? Urbanization. Where it comes? Urbanization. Is it an environmental risk factor? No? Then what is it? Land area pattern. What is land area pattern? Rural, urban, everything comes under urbanization. They didn't give direct, isn't it? Land area pattern, that is also comes under environmental pattern. So urbanization, ruralization, what is that? That is also one of the environmental factors. Next one, contaminated water. Contaminated water is not environmental factors. It is a community or man-made factor, isn't it? Is it environmental? Yeah, community or man-made, isn't it? Fine. Next one, infectious agents. It is not also environmental. And sanitation, that is also man-made or community, isn't it? That doesn't come under environmental risk factors. Environmental risk factors are pollution, land area pattern, then radiation, climate change. These four things are mainly comes under what? Environmental risk factor. What? Environmental risk factor. Got it? So what is the answer? Land area pattern. So what is the answer? Yeah, urbanization. Okay, fine. Next one, direct question. Outdoor or ambient air pollution can result in respiratory distress. So diarrheal disease related to water pollution, hearing loss related to noise pollution, and thyroid related to endocrine disorder. Diet, isn't it? Diet and endocrine, okay, anything you can see. So what is the answer? Air related pollution results in lung related or respiratory system related conditions. Got it? Okay, fine. So here is another concern. BMW. What is BMW? Biomedical waste. Yes, BMWM, biomedical waste management system. Is it biomedical waste management system? Red bag. What are the things we are putting in red bag? Recycled, then rubber, then plastics, then red. Then infectious, yellow, infectious in yellow. Then infected plastic is in red. Infected or non-infected? Infected plastic comes under red. Blue bag, yeah, broken glasses, glasses, glass pieces, ampules, then yeah, very good, antibiotic vials, isn't it? Antibiotic vials, yeah, then cut glasses, everything. So then next one, green.